BLS Final Actual Exam version 1 newest with complete 200 questions and correct detailed answers. Question 1. What is the required position and surface for a patient to receive effective chest compressions? Prone on a soft mattress, side lying on a flat floor, supine on a firm surface, Fowler's position on a hospital bed. To maximize the effectiveness of chest compressions, the patient must be in the supine, face up, position on a firm surface, such as the floor or a backboard. A firm surface ensures that the force of the compression actually depresses the heart between the sternum and the spine, rather than simply pushing the patient into a soft mattress. Question 2. According to American Heart Association (AHA) guidelines, how long should a pulse check take? No more than 5 seconds. At least 5 seconds but no more than 10 seconds. Exactly 15 seconds. Up to 30 seconds for elderly patients. A pulse check must be performed for at least 5 seconds to ensure accuracy, but no longer than 10 seconds to minimize interruptions in chest compressions. If no definite pulse is felt within 10 seconds, the rescuer must immediately begin chest compressions. Question 3. What is a common complication that may result from improper artificial ventilation during CPR? Hypoglycemia, gastric distension, pneumothorax, abdominal evisceration. Gastric distension occurs when the stomach becomes filled with air during ventilation. This often happens if the airway is not opened adequately, using the head tilt/chin lift or jaw thrust, or if breaths are given too forcefully or too quickly, forcing air down the esophagus instead of the trachea. Question 4. What is the first action a rescuer should take when encountering an unresponsive infant? Give 2 rescue breaths. Begin chest compressions immediately. Perform 5 back slaps. Check for a radial pulse. For an unresponsive infant, or child/adult, current BLS protocols emphasize CAB compressions, airway, breathing. The first step after determining unresponsiveness and lack of normal breathing is to begin chest compressions to maintain circulatory flow to vital organs. Question 5. If you observe a visible foreign object in the mouth of an unresponsive infant, what is the correct protocol? Perform a blind finger sweep. Remove the object only if seen and resume compressions. Use a suction device for at least 30 seconds. Ignore the object and continue breaths. Rescuers should never perform blind finger sweeps, as this may push the object deeper. If an object is clearly visible in the airway of an unresponsive patient, it should be removed. Immediately after removal, or if the object is not seen, the rescuer must resume chest compressions. Question 6. What is the recommended technique for performing chest thrusts on an infant during CPR? Use the heel of one hand. Use 2 hands with interlaced fingers. Use 2 fingers placed on the lower half of the sternum. Apply pressure to the upper abdomen. Infant chest compressions are performed using 2 fingers, for a single rescuer, or the 2 thumb encircling hands technique, for 2 rescuers. The fingers should be placed on the lower half of the sternum, just below the intermammary line, to avoid damaging the xiphoid process. Question 7. What is the significance of the AHA chain of survival? It lists the legal requirements for EMTs. Each link is crucial for improving the chance of successful resuscitation. It describes the internal anatomy of the heart. It is a guide for long-term rehabilitation. The chain of survival represents a series of critical actions: 1. Early recognition/activation, 2. Early CPR, 3. Rapid defibrillation, 4. Advanced life support, and 5. Post-cardiac arrest care. If any link in this chain is weak or missing, the chances of patient survival and positive neurological outcome decrease significantly. Question 8. In medical terminology, what does the term acute abdomen refer to? A chronic condition of the stomach lining. The sudden onset of abdominal pain associated with severe problems. A minor digestive issue following a meal. An injury caused by chest compressions. Acute abdomen is a clinical emergency characterized by the sudden onset of severe abdominal pain. It is often associated with progressive underlying pathology, such as appendicitis, bowel obstruction, or internal bleeding, that requires immediate medical or surgical intervention. Question 9. What is the primary function of an impedance threshold device, ITD, during CPR? To measure the patient's blood pressure, to limit air entering the lungs during the recoil phase, to deliver 100% oxygen automatically, to keep the tongue from blocking the airway. An ITD is a valve placed between the airway device and the bag mask. It is designed to limit the amount of air entering the lungs during the chest recoil phase. This creates a negative intrathoracic pressure, which sucks more blood back to the heart, thereby increasing the effectiveness of the next compression. Question 10. When using a load distributing band, LDB, how are chest compressions delivered? Via a gas-powered plunger, by a circumferential constricting band and backboard, through a vibrating vest, by manual hand-over-hand pressure. The LDB is a mechanical device composed of a backboard and a wide, constricting band that wraps around the patient's chest. It uses a motor to tighten and loosen the band, providing consistent, circumferential compressions of the heart, which can be more effective than manual compressions during transport. Question 11. Under which scenario is it appropriate to temporarily interrupt CPR procedures? To talk to the patient's neighbors. When moving a patient up or down stairs. Every time a family member enters the room. To check for a pulse every 30 seconds. CPR should only be paused when absolutely necessary, such as during defibrillation, AED analysis/shock, or when maneuvering a patient through a critical obstacle like a staircase where effective manual compressions are impossible. Interruptions should be kept to less than 10 seconds whenever possible. Question 12. What should you do if you encounter a hysterical family member while performing CPR? Stop CPR and ask them to leave the building. Order them to assist with chest compressions. Calm and reassure them while continuing CPR. Threaten them with legal action. Emotional family members are common in emergency scenes. The rescuer should remain professional, providing calm reassurance that the patient is in good hands, without allowing the emotional environment to interrupt the life-saving CPR process. Question 13. A mechanical piston device is used in EMS to perform which task? To monitor heart rate via EKG, to depress the sternum via a gas-powered plunger, to provide automatic suctioning of the airway, to measure the depth of the patient's breaths. A mechanical piston device, like the Lucas device, is mounted on a backboard and uses a compressed gas-powered or electric plunger to provide consistent chest compressions at a fixed rate and depth. This reduces rescuer fatigue and ensures high-quality compressions during long resuscitations or transport. Question 14. If a patient is found crumpled or face down and requires CPR, what is the first priority? Check for a pulse while they are face down. Wait for a second rescuer to arrive. Carefully reposition the patient to a supine position. Perform compressions on the patient's back. You cannot perform effective CPR on a patient who is prone, face down. The patient must be log-rolled or carefully repositioned onto their back, supine, on a firm surface as the very first step in the assessment and resuscitation process.